The following program is sponsored by the Medicine Center Pharmacies. The mic is open.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsor, Studio Arts and Glass, and of course, our socially distant technical producer, J.D. DeAngelis. We continue our shows from our administrative offices and wish our friends at WHBC and our listening audience continued good health. Our guest today is Dr. Michael Necci from Altman Medical Group, Orthopedics and Sports Medicine. Dr. Necci, welcome to the show. Thanks for joining us. We look forward to talking to you today.
Great, thanks for having me.
Today, we welcome Dr. Michael Necci from Altman Medical Group, Orthopedics and Sports Medicine. Dr. Necci graduated from Des Moines University and did his internship and residency at Western Reserve Hospital. He has office hours in Alliance. Today, we're going to be discussing sports injury and joint issues that require an orthopedic physician. We'd like to remind our listeners that our program is available on our podcast, which can be downloaded from both our website or your favorite podcast app. Look for Health Matters with the Medicine Center Pharmacy, and you can subscribe to our weekly program.
So, Doctor, welcome to the show. Let us know a little bit about yourself, please.
Sure. I grew up here in Northeast Ohio, eastern suburbs of Cleveland, a town called Willowick. Went to undergraduate down in Athens, Ohio at Ohio University. Moved on from there, as you mentioned, to do my medical school in Des Moines, Iowa. Came back here for internship and residency at SUMA Western Reserve Hospital, as it's known now. And then joined the group down in Alliance coming up on 10 years ago. I'm married, have three young boys, age 7 and twin 5-year-olds. Live locally here in Green. Yeah.
Very interesting. So, where do you practice and where do you do your surgical work?
Yep. So our office is located right in the smack dab middle of Alliance, adjacent to the Alliance Altman Hospital. So that's our primary location. That's where I see all my patients at. And I do all my surgeries at the Alliance Altman Hospital. We do have a satellite office that a couple of my partners travel to down in Carrollton right now, and we're looking to branch out and open other satellite offices in the near future here.
But your only surgical practice is Alliance, is that correct?
Correct.
Okay.
Yeah. Mm-hmm.
So, what type of procedures do you perform?
I'm a general orthopedic surgeon, so what that means is I do a little bit of everything. Anything that doesn't involve the neck or the spine. We do shoulder surgeries, elbow surgeries, hand and wrist surgeries, hip surgery, knee surgery, foot and ankle surgeries, fractures, sports injuries, tendon tears. We are able to dabble in a little bit of everything, and we see a variety.
So, do you have a specialty in particular?
I did not do a fellowship. So once you graduate from your residency program, you have the option of doing a fellowship, which would make you subspecialized in a variety of fields. So in orthopedics, you can subspecialize in total joint replacements, where you do a year and all you're doing is primary joint replacements as well as revision surgeries. You could do a sports medicine fellowship where you're primarily doing arthroscopic procedures, complex things. You're working with typically the fellowship programs. You're working with a professional sporting program, baseball, football, hockey, basketball. Spine has the fellowship where primarily then you're just, you're a spine surgeon. You're doing neck and back surgeries. You can do a foot and ankle.
Neurosurgeon along with you on those type of surgeries, spine and stuff.
Well, so there's 2 ways to become a spine surgeon. You can do a general surgery residency and then do a fellowship in neurosurgery, which then includes, brain surgery. or you can go about it through an orthopedic program. You do an orthopedic residency and then do an orthopedic spine fellowship. So when when people in the community hear of a spine surgeon, they can either be a neurosurgeon or an orthopedic surgeon, but the surgeries are the same when it relates to the spine.
Are you doing a team doctor deal with one of the schools? Or?
So we do cover a lot of the local high schools. Our group does, mainly in Eastern and Southern Stark County. And then my partner, Dr. McKean, is a team physician at Mount Union University. Yeah.
Okay. Go ahead, Brad.
Okay. So how about patient ages? What kind of patient ages do you treat?
Any and all. Again, as a general orthopedic surgeon, we do treat pediatric injuries. As rare as they are, we will see them on occasion. If it's very complicated, we will send those up to Akron Children's. We have a relationship with Akron Children's. And then anything up to, the 99-year-old patient who accidentally falls and breaks their hip. So we see a wide range, and there's various injuries depending on those ages that we commonly see.
What about, I'm assuming that the technology advancements in orthopedic surgery are really exciting and give you a lot of new opportunities. Is there anything that you're really excited about that you've seen on the horizon or you're actually working with right now?
Yeah, orthopedics is a newer specialty. I mean, back 50 years ago, if you broke a bone, it was the general surgeon who was fixing it. It's really come about, and it's technology driven. So, in regards to joint replacements, there's been a lot of advancements even in the last 20, 25 years, where the materials that we're making things out of are better. The engineering of the products are better. It used to be you get a hip or knee replacement, it lasted you for 10 years. Nowadays, we're seeing double that, if not more, longevity in these implants. So that's one aspect that technology has come along. One of the things that has really picked up during the last 10 years is biologics in orthopedics and sports medicine. So what I mean by biologics is we're taking material from the body. Typically it's stem cells from bone marrow or plasma, which these stem cells and plasma carry with them are normal healing factors, and we're able to harvest these and then inject them or implant them in various sites to aid in healing. And so the research in this is continuing to evolve. There's a lot of promise with these for prolonging surgery in a lot of cases, if not preventing it.
How have robotics changed orthopedic surgery?
It's still evolving. Robotics is a very exciting thing that has occurred. So, robotics has been around for a while. Started initially with the Da Vinci system for cardiothoracic surgery, and has evolved now. I think in orthopedics, there's 7 or 8 companies that have their own robot. It's a misconception. The robot's not doing the surgery. The robot, typically it's an arm, is aiding the surgeon in the procedure. And there's CT scans that are done ahead of time. There's intraoperative navigation systems that are used as well. And the thought process or the design behind it is to make the surgery. So if we take, for example, a knee or hip replacement, to make more accurate cuts in the bone, align the components better when you look at it and examine it on x-rays. And then, so what is still under research is, does that make a difference? Does the precise nature of these implants and the cuts make a clinical difference in the patient's outcome. And that is where the literature isn't quite clear yet. We need more research in that. The robotics systems are very expensive for hospitals. So right now you won't find that at your local, community hospital. Those are more at the bigger institutes that are doing these. And even then, there's only certain surgeons that are actually trained and proficient in using these. It does increase surgical time because you do have the robot that you need to help guide and put the inputs in and have them make the cuts. So, there's potential drawbacks for increased surgical time, increased complications. Anytime a surgery takes longer than what it normally was, you do have increased risks of infection and other complications. So again, it's a promising field. I think it certainly plays a role and will play a role in the future. But there's still more research that needs to be done.
Sounds like the size of some of your incisions maybe aren't as much of a problem as they would be in other surgeries, like a gallbladder removal or something like that. But precision sounds intriguing to me. So.
Mm-hmm. Yeah, and like I said, it anytime you can take out any variable in surgery and improve something, we certainly should look at that and make all efforts to do what's best for the patient. But again, we need data to show that there is a clinical difference, not just making the x-rays look better.
It
Yeah.
seems to me that when you graduate from medical school nowadays, there's an overwhelming amount of things or treatments to learn compared to 20 years ago. Or, we got robotics, we got all this other, when somebody had a hip replacement years ago, they're in the hospital for 2 weeks. Now they walk out the next day or something like that. So I'm here. So.
Yeah, and that goes to what I was referring to as far as the technology and the engineering of the implants, the way that we do surgery. So you mentioned incision size. It's not so much the length of the skin incision that's the difference. It's what you do beneath that matters. So going with that, the anterior muscle sparing hip replacement is something that I wasn't trained in when I came out of residency, and I went through training and had made that switch to do those anteriorly about 5 or 6 years ago. And it's amazing the difference. So when you mentioned, my patients are going home the next day, and there's lots of surgery centers out there where the patients are going home that day. Younger, healthier patients that don't need to stay in the hospital, and it's because of the way that we do the surgeries, going in between the muscles, and then the engineering of the way that we're able to put these implants in. I mean, we're going through incisions that are this big, and you look at the x-rays after, and you kind of astounded by how did we get there through an incision so small. But it's advances like that are occurring all the time in orthopedics that makes it very exciting on my end, to be going through that. So yeah, coming out of medical school and residency, it is, you don't know what you don't know, right? Yeah. So it's a constant learning. You're always learning and developing your skills.
Somebody always figures out how to do it different.
Right. Mm-hmm.
Okay, Doctor, we're going to take our first break here. Listening to Health Matters with the Medicine Center Pharmacy.
Announcer guy. Nerva and New Philadelphia. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking today with Dr. Michael Necci from Altman Medical Group Orthopedics and Sports Medicine. Have a question? Post it on our live Facebook feed.
Okay, doctor, how has COVID-19 had an impact on surgeries and treating patients?
Quite a bit. When this all first started back in, end of February, beginning of March, you know, there was lots of talks, obviously, from the national level, the CDC giving hospitals directions. And then, you know, middle of March, Governor DeWine came out and basically, you know, halted all elective surgeries. And from an orthopedic standpoint, that's quite a bit of our business. You know, we do take emergency room calls. So, you know, the people that fall and break their hip or their ankle, shoulder, any major tendon injuries, infections, anything that was urgent that, you know, couldn't wait, we were still doing surgery. But hip and knee replacements, shoulder replacements, torn meniscus in the knees, some rotator cuff tears. You know, there's quite a bit of our elective cases that had to be put on hold. That was from the middle of March through April. And then beginning part of May, they started opening things up a little bit. We're able to start doing, you know, elective outpatient surgeries. We were very selective in what patients we were bringing in, specifically our younger, healthier patients, those that are at lower risk for contracting or having complications from COVID, should they have been exposed to it while being in the hospital. And that risk still carries with it to today. So for the month of May, we kind of unloaded our backlog of patients that had been waiting, you know, that were scheduled for the end of March and April. And we're finally making our way through that backlog. And then starting beginning of June, Governor DeWine allowed us to start opening up and doing our normal inpatient surgeries. Again, you know, we're trying to be selective in our patients. Any patient that is, you know, older, has other medical comorbidities that might make them, you know, higher risk of having complications should they contract COVID-19. We're having them a long conversation with them, and, you know, obviously making sure they're aware of all the risks. And Altman Hospital has taken all proper precautions in regards to that. They're screening everybody that comes in to the hospital. Everyone in the hospital is wearing masks. So, you know, we're doing all that we can to prohibit another spike, which is, you know, obviously the concern with opening things up and increasing, you know, traffic in a place like a hospital.
Well, tell me, are you caught up yet?
Yeah, we probably within the last week and a half, I think we finally caught up with all our backlog. But you know, and there's still some patients who we called, and, you know, they just decided that they can live with their pain.
I don't think anybody wants to go to the hospital right now.
Yeah, there's a fair number of patients who are you know, resistant to coming in, which, you know, is totally understandable at this time.
Yeah, interesting. So the older folks are they, you know, obviously those are the people that are more prone to the current virus that we're talking about. And, you know, so how do you talk somebody out of can't move? I mean, literally.
Well, they're right. So the patients that are, you know, have their bone-on-bone arthritis and are severely limited in doing normal daily functions, they, you know, they really, their response is they don't care. They don't care. They want their hip or their knee fixed, or, you know, whatever pain that they're suffering from, they want it fixed, and they're willing to take that risk. So, you know, there's not much coercion or anything that on our end that needs to be done. The decision is entirely up to the patients, but I have seen that those patients who have been suffering, and, you know, because it's a quality of life issue. I mean, that's part of, you know, why we do joint replacement surgery and, you know, our arthroscopic outpatient procedures is the quality of life. You know, patients are limited. They can't, you know, go out into the garden and do what they want to do. They can't play with their grandchildren, or go on a walk with their spouse. I mean, that if you're unable to do those things that make life enjoyable, you know, it weighs on you, and, you know, these are potentially other medical issues. So I'm happy that we're back up and running and helping those patients out.
Okay, Doctor, it's the bottom of the hour. We're going to take the news here. Thanks for joining us this morning on New Health Matters with the Medicine Center Pharmacy.
Canton, Louisville, Minerva, and New Philadelphia.
Your severe weather station, News Talk 1480 WHBC.
Here's your AccuWeather forecast. It will be partly sunny today. We could pick up a shower or thunderstorm this afternoon. High today 81. A shower in places for this evening. Otherwise clearing tonight. Low 63.
Stand by for open mics, and I will run the announcer introducing you.
Tomorrow afternoon. High at 85. Sunday and Monday, sun and some clouds, warm and humid. A shower or thunderstorm. High both days 86. I'm Steve Williams for News Talk 1480 WHBC.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Today, Brad and I are discussing orthopedic and sports medicine with Dr. Necci. I got to ask you this question before it gets away. What about copper in these elbow braces and stuff?
Yeah.
I get people in stores say these are absolutely fabulous. They really work good. So what's the deal?
You know, it's anecdotal. There's you know, the companies will show you their own research that, you know, for increased blood flow and healing and all that, but it's anecdotal. I tell my patients, they come in and ask me, try it. If it works for you, great. I can't recommend it, but, you know, there are patients that it does help, you know, whether it's placebo effect or, you know, if it truly does have some sort of, you know.
Years ago in the pharmacy, we actually had from Lilly, we had placebo capsules, okay, and they had lectins, okay, and it was a blue one and a green one, or a red one and a blue one, I forget whichever. But we would actually have people that back in those days, you know, we didn't have very many antidepressants. In fact, I don't think we even have any. You know, we had Librium, which isn't really a truly, you know, whatever. But we would switch people, the doctors would switch people from one color to the next. And, oh, yeah, that works great. So the new color works great.
Absolutely.
Okay.
Yeah.
Well, anyway, I think we already hit this question, but what about patients? Uncomfortable going in the hospital? Is that the first thing they ask you?
No, I mean, at least in Alliance, you know, most patients that I've come in contact with and discussed going to the hospital for surgery, I would say 9 out of 10 don't really bring up COVID-19 as a worry. That might be different in different areas of the state or different areas of the country, but at least in my experience, it's not an issue. And those that it is an issue for, that's fine. That's their prerogative. And, you know, we tell them to give us a call whenever they feel comfortable coming back in. But like I said, the hospital is doing all that it can. The way that we interact with not only the staff, but the patients in the hospital has changed. Everyone's in masks, goggles. Everyone is secluded. There's constant cleaning going on, more than normal. So I wouldn't have a problem having, you know, any of my family members or anybody come into the hospital should, you know, they need something done.
So in your office, do you have to wear a mask when the patient comes in? I mean, are there certain restrictions to enter your office?
Yes. Yeah. We scan everybody, temperature scans, ask, you know, go through a screening process of questions symptom wise. And everyone is given a mask to wear. All our staff wears masks. If we're going to be in contact with a patient, in a room for more than 15 minutes, we wear goggles.
Okay.
All right. So now that people are much more active outdoors, I see Saturday is like the first day of summer officially, I believe. Are you going to see, or are you seeing already an increase in the number of common injuries?
Yeah, there's, seasonal injuries, certainly. In the summertime, like as you mentioned, with people being outdoors, we'll see more of our sporting type injuries. So we'll see more tendon tears. We'll see a lot more pediatric fractures, especially of the arm. Lots of trampoline injuries. My kids were just asking me the other day when can we get our trampoline, and
Yeah.
I have to tell them that that's not going to happen at this house. But and then in the wintertime, we'll see more of our slipping and falling type fractures and injuries. So there is a seasonal variety to what we see, but in general, as a population, our baby boomers are staying much more active than their parents' generation is. It's been impressed upon us, fitness and activity for health. So we see a lot of overuse type injuries as well. In the summertime, there are certain things that we see more than others. Sure.
Given that you see different things more often in the summer, any tips for people to be a little more cognizant so they don't, maybe it makes them stop and think before they do something that may be a little careless to cause an injury?
Sure. Well, I have no recommendations for how to improve common sense, but there are some things that we can do. Stretching. So that's probably the biggest non-compliancy that I see is stretching. And not stretching leads to these chronic overuse type injuries. So, in sports, our kids nowadays are in year-round sports. I mean, even when I was growing up, I played variety of sports, but it seemed like there was breaks in between. Whereas nowadays, these kids are going back to back. There's overlap in sports. There's camps. There's a lot more things that they're doing now. And so we are seeing more overuse type injuries in pediatric patients, especially our throwing type sports, shoulders, elbows, in softball, baseball, tennis. And then in our older population, as I had mentioned, just staying active, whether they're playing tennis or pickleball is something new that I never heard of until I moved out this way. But just stretch before and after whatever activity, exercise or activity that you're doing. Just gentle stuff. You don't need to make it anything, that's, cumbersome or something that's not going to make you do it. Just take a couple minutes, stretch your arms, stretch your legs, and that can help limit, potential injuries.
What do you think about this? I mean, you were just talking about year-round sports for these kids,
Mm-hmm.
And I got a couple of grandchildren, one's 10 and one's 13, and they're both pitching. Mm-hmm. And the 13-year-old, I think they limit him to 50 pitches. And I'm thinking, here's a kid who really, they're both good athletes, but here's a kid who just really, you can't give a 13-year-old or a 10-year-old a weightlifting or a, I don't know what exactly you call it. Mm-hmm. But I keep thinking about this. These kids are awfully young to be, using their arm that much when it's not conditioned, I guess is the right word I'm looking for here. It can't be conditioned, What do you think?
I'm sorry, you cut out right at the end there. What was the end of the question?
What do you think about these young kids that are pitching 50 pitches in a bog?
Right. Yeah, and I guess the concern is okay, they do 50 pitches on Monday. Are they going to go back out and do it again on Wednesday and Thursday and Friday? And that's where those lead to these. There's a condition we call little leaguer's elbow, which is inflammation of the growth plate about the elbow, from specifically what you talked about. There's every time you throw a pitch, that's a lot of force going through the joints, and especially on the deceleration. So every pitch, there's some sort of, micro trauma to that area. And if you just keep repeating that and don't give the body time to heal, that's what leads to these
The 13-year-old is not exactly lobbing it over the plate either.
Right.
I mean, it's forceful what he's doing.
Right. Mm-hmm. Yeah, that's about, and that's typically around the age that we see these things for that specific reason. Is they're maturing, they're getting bigger, they're getting stronger just by nature of growth. Sure. And so they're able to produce these forces more akin to an adult, but skeletally they're still immature and are prone to these types of growth plate injuries. So it's a concern, and hopefully that's where education. I know coaches, at least at the school level, I can't speak for summer leagues, but they're required to do training for these types of reasons. So I think a pitch count is a good idea. What that magic number is, I don't know, but.
Well, I just was surprised they both have been pitching, particularly the 10-year-old. Now she's not forcefully throwing the ball back there. But, it's different to see a 10-year-old pitching. So,
yeah.
So anyway, I'm sorry, Brad. Where are we at?
Well, we've been talking about sports-related injuries. I'm guessing you didn't see as many in the last 3 months with COVID, but things are, like you said, kind of picking up. I mean, I guess talking about younger kids, and I'm kind of wondering if athletes, student athletes or adult athletes have been kind of maybe out of their normal routine. There's some things that they really need to ease back into and not just dive headlong back in. Do you have anything to comment in that regard?
Yeah, I think that's a great point. Gym shut down, so you couldn't go to your local gym. There's videos, Facebook and Instagram of people doing, creating home workout and exercises. But to your point, they're probably not as intense or maybe not as frequent as what they normally would be akin to. So then, yes, if you start back up and go, 0 to 60 and try and pick up like you were, 4 months ago before everything started closing down, you are at slight increased risk for injury, certainly. So again, that goes back to stretching, easing back into things, and incremental increase in your load and in your training.
Very good.
I guess it's time for our last break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your host, pharmacist Paul White. Thanks for joining us today. Let's get back to the last segment of the show. You have one question left, Brad, or did you get it?
Nope, we got it. It's on for pain management now.
Okay. How about athletes, the big-time athletes? Are we seeing less and less injuries in these guys? Newer helmets, newer this, newer, newer braces.
Yeah, that's a good question. I don't know if there's any literature specifically regarding that. I guess my opinion is yes, we're seeing less of those acute injuries, but the athletes nowadays, I mean, just look at your football players now compared to back in the 40s and 50s and 60s.
I know I was reading something the other day, and they said it wasn't uncommon for somebody to get killed in a football game back in the 20s and 30s. I'm thinking, you guys, what's this about?
that's that's a whole different ballgame. But I mean, again, going with that technology, like we started out talking, I mean, it's coming a long way, specific for football specifically. But yeah, I don't think there's any good research or data to say one way or the other if we're seeing less injuries in our professional athletes.
So what about pain management? There's been a real circle here in the last few years on, narcotic type pain relievers and things like that. So what about topical products? I mean, are you using many topical products?
Yeah, I don't we don't do any of our own compounding or anything like that. But I encourage patients to try that, certainly, as part of the initial, conservative treatment plan that we have. Topical anti-inflammatories and medicines play a role as well. Sometimes we have patients that have medical conditions or on other medicines that, that probably isn't a good idea. So there's a variety of topical things out there. I tell them to start with, basic over-the-counter stuff, your BioFreeze, your Aspirin creams, Icy Hots. There's a medicine, a newer one that's over-the-counter now, Voltaren, which used to be prescription only, is now anti-inflammatory over-the-counter topical medicine. So I encourage patients to try them, obviously talk with their primary care doctors to make sure there's no contraindications. And, it's just another adjunct treatment that we have, when you're talking to patients and going over all their different treatment options, you get to the S word, surgery, and, a lot of patients just start shaking their head no right away. We offer those, and, works for some patients for certain conditions and doesn't work for others,
I think of it this way as a pharmacist, that people are dumping so much stuff in their body internally. This pain reliever, Tylenol, whatever, plus our blood pressure, plus I keep thinking, gosh, if we can find a topical solution. One of the hottest things right now in our store is lidocaine patches. They used to be on prescription, not too awful long ago.
Right.
And we seem to be selling a fair amount of those. A lot of nursing home people are using those, that sort of thing. And I've actually tried them once on a hip or something like that. I thought they worked pretty well for a short period.
Yeah.
I don't know if you use any of those, but
the only time I can remember prescribing it would be for somebody who came in with multi-traumas and had rib fractures or, rib injury, and I would tell them to slap a lidocaine patch on. I had difficulty getting them approved through insurances, so I just stopped prescribing them, and told them to look for over-the-counter, equivalents or whatnot. So.
And they're relatively inexpensive nowadays. I think the 4x4s are $6 or, something like that. So I think the problem with them, though, is it is a patch. And adhesives on it. It's not going to stay where you want to keep it if it's in the hip area or something like that. So it's not going to stay very long. But it do work. So.
And we have to find alternatives to narcotics. For years, pain was the fifth vital sign, and we were encouraged to treat pain. And unfortunately, I think that's led to some of the issues that we're seeing nowadays with the narcotic abuse and street drug use. So anything that we can do to treat pain other than that,
I guess because of a situation we ran into when we were in Maui years ago. There was a lady there from Canada, and she was telling me that she broke her hip. I said, okay. And I said, where were you? She said, I was in Canada. She said, I had to wait 6 months for an MRI. And she said, meantime, I got addicted to Vicodin. So, okay, then wonderful. But apparently I don't know what the condition of healthcare is in Canada these days, but they only had one MRI in this part of the country. So people were lined up by the dozens, before they did surgery. Certainly not the situation here in America, but I thought that was a very interesting situation.
Yeah. I think it's having that discussion with the patient, what the expectations are, since all these legislations have come down and we're gearing away from prescribing narcotics. I think if you just have that conversation with the patients ahead of time and let them know that they're only getting, one refill after surgery, and then they have to rely on other measures for pain control. It sets that standard, sets the expectation for them. It helps.
Go ahead, Brad.
When should a patient seek out an orthopedic surgeon or get an orthopedic referral instead of talking to their regular provider?
I mean, talking to your regular doctor about any musculoskeletal issue that you may be having is never a bad idea. At our office, we see patients without referrals needed. So, we have a primary care sports medicine physician who will treat anything that is non-surgical, just as your primary care doctor would. So if we're just talking in generalities, I'd say you can call an orthopedic doctors for any complaint, at least get evaluated. And at best cases, there's nothing surgically needed and you can treat it conservatively. However, if the injury is severe enough and needs surgery, then you're already plugged into the practice and the surgeon.
I think this is a really good spot for you to put your contact information for our listeners so that they can reach out to you if they need that referral or that contact evaluation.
Great, thanks. So our practice is located at 1900 South Union Avenue in Alliance, Suite 100. You can call our office, area code 330-596-6500. And we offer same-day appointments. And we're usually able to get patients in that same day. If not, then certainly the next day.
Nice. Any exciting comments you want to leave with our listeners as we wrap up?
No, I appreciate it. Everyone stay safe, stay healthy, and enjoy the summer weather while we have it here in Ohio.
Well, thanks, Doctor, for joining us.
Thank you, Dr. Necci, our very special guest today, Altman Medical Group, Orthopedics and Sports Medicine. We'd like to thank our listeners. If you suspect you have a medical issue, please contact your healthcare provider. And thanks to our sponsor, Studio Arts and Glass, and of course, our technical producer, J.D. DeAngelis, as always. We thank you, our listeners, for listening to us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we see you right here Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy. Your pharmacists, Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy.